This meeting will now come to order. Good evening. City Council will convene on Thursday, January 28th, 2021, to hold a regular meeting at 7:30 for the purpose of discussing any and all business via in-person participation for the City Council only and remote participation for all others, in accordance with Chapter 40A of the Massachusetts General Laws and Governor Baker's Emergency Order dated March 12, 2020. In accordance with the Governor's order suspending certain provisions of the Open Meeting Law, General Laws Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the City Council will be conducted via remote participation to the greatest extent possible. No in-person attendance of the members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. Alternative public access to this meeting shall be provided in the following manner. Number one, this meeting is being televised by Peabody Access Television on Channel 9. Number two, real-time public comment during public hearings can be addressed to the Peabody Council utilizing the Zoom virtual meeting software for remote access. Zoom application users may view the meeting and make a comment or question to the chair via the audio option. This meeting is being televised live on cable Channel 9 and is being taped by Peabody Access Television and is also being recorded by our City Council stenographer. Let's all rise for a moment of silence. Now please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Move approval of the record, Mr. President, from, I apologize, I don't have the date. I can get that date, Mr. President.
January 14th, 2021, Council Gould.
January 14th, thank you.
Thank you, Council Gould. You've heard the motion by Councilor Gould. Are there any corrections to the minutes? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Matsoulis,
Yes.
Turco,
Yes.
Rossignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Before we begin our next meeting agenda item, I'd like to invite His Honor Mayor Betancourt and our Health Director Sharon Cameron to speak and provide an update on COVID-19 as well as information regarding vaccinations. Mayor Betancourt and Director Cameron, thank you for coming. Welcome.
Mr. President, and good evening, Council. I did want to congratulate and wish the very best for Craig and Emily Welton on their birth of their son, Samuel John. I think that's 12 or 13 kids for the Weltons, I believe. But everybody's doing well, and I just wanted to wish them the very best. Congratulations. Let's give us. So, if you look to the screen, that's why we're here today. I try, as I always do in this position, to try to be positive and be upbeat. So when we put out some messages yesterday on our social media platforms, we referred to that as a hope in a box. That's 100 doses of the COVID-19 vaccine from Moderna. I've tried to refer to that as hope in a box, but to me, quite frankly, it's disappointment in a refrigerator. Just think for a moment. We have 53,000 people in the city of Peabody. We have at least over 15,000 over the age of 65 who are our most vulnerable, most at-risk people, clearly from the numbers, and Sharon will be outlining many things to come. But all of you, I know, have received many calls from concerned people about vaccination and when they can get vaccinated and what's the plan. All very legit questions. My phone certainly been ringing off the hook. Text messages, emails. Darrell Ann McCarthy is fielding calls continually. The amount of calls that have been going to the health department have been extraordinary, all with important questions and all legitimate concerns. And people are angry, as I think all of you know. People are angry, they're frightened, they're aggravated, they're concerned, and they're confused about what the next steps are. Right now, the rollout from the state has just been mired in confusion. We are getting information every day that's different than the day before, and there's just a great deal of conflicting information that has really caused a great deal of grief and anxiety and stress by all the members of our society, which just cannot continue to happen. Just to give you an idea of the conflicting information, last Sunday evening, this past Sunday, at 10:21 p.m., we got a written email, or an email, from the Massachusetts Department of Public Health, confirming in writing for the first time that cities and towns will only be receiving 100 doses of vaccine for at least the month of February. For the next 5 weeks, that is what we were promised, 100 doses of COVID vaccine per week, at least through February. Now, at the time we got this email, we didn't have any vaccine. The refrigerator was empty. Now, we had a vaccination clinic that was set for Wednesday to continue phase 1 operations, and Sharon will run through the phase 1 operations. Public safety officials, healthcare workers, congregate care staff, and others. We had a vaccination clinic set for Wednesday. We had no idea if we were going to be getting the COVID medication or the COVID vaccination at that time. We were on pins and needles worrying if it was going to come or not. It thankfully came on Tuesday. We took a picture, and that's what we received on Tuesday. We had the vaccination clinic yesterday. It was moved, the location, from Peabody High School to the Higgins Middle School, but thankfully we were able to, Sharon oversaw the operation, first class as always, and we were able to vaccinate over 100 Peabody residents for the phase 1 operation. What I'm asking today, and I'm hoping for your support on, is to ask the state to request to allow cities and towns. Now, I'm going to be speaking for Peabody, but this applies to every city and town because they're right now under the same directive that we are, 100 doses per week. We're asking to play a larger role in vaccinating our residents. And there's really 4 reasons for this. 1, we have the infrastructure in place. 2, we have the resources necessary to do the vaccination. 3, we have the knowledge and experience. And 4, we have an outstanding team here in Peabody. I just want to speak a little about all 4 of those for a few minutes. In terms of infrastructure, we have several sites which are conveniently located that everybody in the city knows where they are, offer plenty of free parking, and are suitable in size to safely vaccinate many people. These include the Higgins Middle School, where we have administered thousands of COVID tests for the last few months. The high school, where we have been holding our phase 1 vaccination clinics. The senior center, where there is incredible support staff available to help our older residents with online registration and assist those who do not speak English as their primary language. And 4th is the North Shore Mall, and I'll have more on that very shortly. In terms of resources, we can get accurate vaccine information out to thousands of Peabody residents quickly through a variety of channels, including our robocalls. Yesterday, my update that I put out on robocall, that reached 48,000 contacts that we have in our database and nearly 2,000 email messages. Our social media platforms, including Facebook, Twitter, and Instagram. Peabody's television, Peabody TV's bulletins on Comcast and RCN cable, as well as their social media. Highway billboards, which are seen by thousands of people every day. Traditional news media, including the Salem News, Peabody Weekly, The Patch, the Lynn Item. Those are all available to us where we can get information out to people within a matter of minutes. In terms of knowledge, we are fortunate to have decades of experience here in the city of Peabody, administering vaccines during our flu clinics, holding vaccine clinics, identifying those in our community who are most vulnerable. Who better to know that than the people who live in the city and the people who are in touch with the community? We know where our senior centers are. We know where the senior homes are. We know where the most vulnerable people in our society are and what is best for them in order to get information to them and get them vaccinated. And we have transportation in order to do that with the buses we have at the Council on Aging, all available to help people. Finally, we have an outstanding team led by Sharon Cameron. And I truly believe, even more so over the past 10 months, that she is the best health director in the state of Massachusetts. We've had regional meetings that I've got to see her with her colleagues, and they look to Sharon for leadership and guidance. We're very fortunate to have her leading this team. The amount of work she's done over the past 10 months is amazing. We have our public health nurse, Chassie Robinson, our school nurse leader, Brenda Wolf, and just an amazing group of nurses and people just ready to help like they have been for the past 10 months. And the good news, and I'm sure a number of you have received calls from people just looking to volunteer and help, nurses in our city, just people that want to be of assistance and provide for their fellow citizens, which has been great to see. But we have the ability to staff and man and have people available to help with this. At this moment, nothing matters more than getting our residents vaccinated as quickly and safely as possible. This has to be done, and I don't understand why it is taking so long to get cities and towns the vaccines that we need to do our jobs. That's how we protect those most at risk from the virus. That's how we get our students and teachers back in school every day, which we all want. I can certainly speak quite a long time, as I know all of you can, about the devastation this is causing our seniors, not being able to get out of the house, not being able to connect with their friends and relatives, and just being engaged in society. What it's meant to our students, I can speak firsthand. I have 4 students in the Peabody Public Schools. The effect that this has had on them is immense. It is not being overstated that our kids are at risk severely in their mental health, in terms of their stress, their anxiety, their depression. This is very real, and we need to get kids back in school as quickly as we can. And our teachers, who have just done an amazing job under these terrible circumstances, they deserve to be vaccinated quickly, and they need to, and they've been tremendous to work with. Very difficult job. It's never been more difficult to be a teacher. And this is how we get, by vaccinating, this is how we get our business owners back on their feet and people back to work. We've been treading water, trying to make things work for the past several months, and to get people the vaccines is the only way to get our economy going again, to get our education going again, and to do what's right for the citizens of our city. We need all hands on deck. All I'm asking for is for us to be part of the team. We have been cut out of the process. It is being run through, and understandably, there's super sites that are certainly going to be out in regions. Ours is going to be over at the Hilton Doubletree Hotel over in the Middleton-Danvers line. And there's going to be other regional sites, not in Essex County, but across the state. There's being pushed towards the pharmacies, towards the primary care physicians in the hospital, which is all understandable. But we need to take part in this process, because the city of Peabody, like all the cities and towns, we have the infrastructure, we have the knowledge, we have the resources, and we have the team to do this and be part of this team. We're not looking to take over the operation, certainly, but we can be part of it, and we can assist the state in getting the vaccines to people. Enough of the confusion, enough of having trouble working the computer and getting signing up for the tests. It is extremely difficult for people who are not computer savvy. We need to be able to provide them, and I think we can do that here in the city of Peabody, provide them those resources to make it work. But we need to step up here and let the cities and towns play a role and be part of the team. That's what I'm asking for, and that's what I think we need to take the next steps here in the city of Peabody. I want to thank all of you. All of you have been tremendous advocates, reaching out to me personally, reaching out to Sharon Cameron for assistance and questions, all legitimate, important questions, and I really appreciate the support. This is a tough one for all of us. There's no easy way to do this, but we have a great deal of information we're going to provide to you. We have plans in place that have unfortunately been put on hold because we're not part of the team right now, and we will speak to them shortly. But I really appreciate all your support and assistance. This is just a team effort totally, and I think Peabody can step up and do even more if the state allows us to be part of the team. I'm going to turn it over to Sharon Cameron for a presentation. She has a great deal of important information that we'll go through, and I'm certainly available to answer any questions.
Thank you, Mayor, and thank you, councilors, for affording me the opportunity to provide an update to you tonight. I am going to start, before we talk about vaccination efforts, I am going to start with a data overview, and I really am going to focus on local efforts and local data today because there are other avenues for people to get other pieces of information, but I thought it was really important to focus on the local picture. So this is the broad overview of what the data looks like as we speak today in Peabody. So to date, we've had 5587 cases in total. 9.5% of those cases have been in long-term care, and that's a marked difference from where we were in the spring when about a third of our cases were in long-term care facilities. Tragically, we've had 264 Peabody residents who've died as a result of this illness. 74% of those people were in long-term care facilities. On a brighter note, we've had 4,152 people who've recovered from illness. That means they have been case managed, they've fulfilled their isolation requirements, they're no longer symptomatic, and they've been released from case management. That represents 79% of all our cases. And we're currently managing, either ourselves or in partnership with the State's Tracing Collaborative, over 1,000 active cases. I did want to point out, though, that the true number of cases that we're managing is much higher than that, because that number, 1093, really reflects Peabody residents with COVID. But every employee who works in a Peabody business who is positive, even if they don't live in Peabody, we participate in case management of them as well because we're concerned about workplace exposures. We work to protect coworkers. We work with businesses to implement COVID safety plans to make their work environment safer, both for their employees and for the customers. So that number really does underrepresent what the nurses are doing in terms of case management. This is a picture of what the day-to-day new cases look like. And you can see back in April, in the early phases of the pandemic, we had a surge of cases, and over the summer months, we had a little bit of a lull. And then heading into the fall and the holiday season, we had a tremendous spike, which we're just now coming out of. Many of these fall cases are household exposures, one person in a household becoming positive and infecting everybody else in the household. But a significant number of those cases are related to social gatherings. And also, as the economy opened up over the summer when we had positive numbers, businesses opened, people started to resume more normal activities. All of those activities moved indoors. Dining moved indoors, sports moved indoors, lots of kind of recreational venues that had been closed back in April are now open. And all of those factors contributed to this big spike of cases that we have seen throughout the winter months. So this is a really important metric. I think everybody is familiar with the state's maps, the color-coded maps, red, yellow, green, and I think everybody is aware that unfortunately we've been characterized as a red high-risk community, and this is one of the metrics that they use to make that determination. This is the average new daily case rate per 100,000 people. It's a way for the state to standardize that metric across communities of different size. So actually, this comes out on the weekly report from the state, and today's data, which I came out at 5 o'clock and I was able to get into the graph, shows that we're making trends in the positive direction. Our average daily case rate for the 2-week period, most recent 2-week period, was about 78. I do want to point out, though, that horizontal line you see at the bottom, that is a rate of 10 new cases per day. That is the metric for when the state considers you to be high risk. So even though we're trending in the right direction, we're still about 8 times higher than where the state would consider us to be a high-risk community. Peabody is on the left, by the way. The state data is on the right. So the second metric that the state uses to determine your risk category is the percent positivity. And this number tells us of all the people in Peabody who have been tested, the percentage of them who have come back positive. And the metric, the cutoff they use is 4%. So we've been hovering up about 10% or higher over the past several periods. But with the data that was released today, we again made a trend in the positive direction. We're just under 8% positivity. So we're still twice as high as the metric that gets you into the high-risk category. So we're making progress, but I think the overall message is that there's still very high prevalence of virus in our community, and people need to really continue to keep vigilant and take all the precautions that people know so well. So every week we put a full data set up on the city website, and I'm not going to go through all of that data with you today, but I did want to point out a few charts that I thought would be of relevance today. This shows you what the breakdown of cases looks like by gender, slightly more females than males, and also by age. And the age pie chart on the right shows that we've really got cases distributed through the whole range of ages. And this is different, again, than we saw in the spring when the pandemic first hit, because back then we were mostly only testing people who had symptoms, and many of those people were in long-term care facilities. Now that we're doing broader surveillance testing and people without symptoms are getting tested for various reasons, we're finding cases in every age group. So this shows the median age of cases in Peabody by month. And again, back in April when we were testing symptomatic people, our average age was older, but again, now the average age of our cases is about 40, 41. So this reflects the fact that there's broader surveillance testing going on in our community. The fact that, you know, our average age is 40 means people out in workplaces, people who are in the community, it's, you know, out playing with their kids, participating in sports, you know, all around us, people in that age range are carrying virus. This slide is important. I know everybody has heard that there's a disproportionate impact of this disease on communities of color, and that's nationwide, that's statewide, and that's also going on here in Peabody. In Peabody, about 10% of our population is Latino, but they represent 13% of our cases. That's the green wedge of pie. Our Portuguese-speaking residents comprise about 18% of all cases in the city of Peabody. So I think it's really important to keep that in mind. Part of the state's strategy with vaccination is to try to address some of these inequities and to direct more vaccine to communities of color. This is what our hospitalization data looks like. We've had a total of 258 Peabody residents who've been hospitalized during the course of the pandemic. Currently, we have about 55 Peabody residents in hospital. There were a lot more hospitalizations at the beginning of the pandemic than there are now, as they have learned better to recognize signs and symptoms, and treatment options have improved. I know everybody heard around the holidays, the hospital presidents were expressing a lot of concern about the capacity of hospitals to take in patients and potentially manage them. That has eased up a little bit now that we're starting to get past the post-holiday surge. As of today, in this northeast part of the state, there were about 11.2% of hospital beds were unoccupied, and about almost 14% of ICU beds were available. So that's progress. I think they would like to have more reserve capacity in the system, but we're in a much better position than we were right around the holidays. I wanted to put this slide up because I think it speaks to why the state, the next few slides will really shed some light about why the state made some of the vaccine priority groups that they did. So this slide shows that even though only 10% of our cases here in Peabody had underlying health conditions, almost 50% of the cases that ended up being hospitalized had underlying health conditions. So people who have those comorbidities are absolutely at a higher risk for severe outcomes, and that's why they're one of the higher priority groups to be vaccinated. And this slide shows the deaths in Peabody by age group, and you can see a really severe toll taken on our elder population. The over 80 population in Peabody represents over 74% of the deaths in our community. And again, that's reflected in the vaccine priorities that the state has established, where the people who are over 75 are at the top of phase 2 for vaccine priority. So I know all the focus right now is really on vaccines, but I think it's really important to recognize that testing will continue to be an important part of the strategy of addressing this disease. We have requested multiple times to be considered to host a Stop the Spread site. Those are the state-sponsored testing sites that are scattered throughout the state. The state infrastructure sets them up. They pay for all the testing. They have declined us repeatedly. And the reason for that is that early on in the pandemic, when other communities around us were at higher risk than we were, they created infrastructure for testing in Salem, Lynn, Revere, and Saugus, and they feel like this area of the state's very well covered, and they're not willing to set up additional Stop the Spread sites. We would love to host them. But because they haven't, even though we do have sites around us, we recognize there's a convenience factor. We have partnered with Atlantic Ambulance to offer testing to city residents and to city employees. We've funded this through some grant funding, through some CARES Act funding, and we expect going forward that we'll continue to offer these events twice a month. We've got a couple dates in February that have already been publicized. The links for those sign-ups won't become active till about a week before the event, but those dates are already out there. So this is a summary of the testing events that we've sponsored. We've had 14 events targeted to different groups. We've tested over 4,500 people, identified 259 positive people through those testing events. So the statewide vaccination plan, as the mayor has said, there is a plan that the state has developed. And that plan relies on most of our population to be vaccinated through hospitals, through their primary care providers, through community health centers, pharmacies, and mass vaccination sites. Those are the sites that most of the population of Massachusetts will be vaccinated at. Local boards of health were not even envisioned in that plan to play any significant role in vaccinating until we got to the phase that's slated to begin in April, when there's plenty of vaccine available and the general public is eligible to be vaccinated. But in late December, the state said to us, hey, if the local boards of health would like to step up and start vaccinating early, your first responder populations will make some vaccine available. And of course, we jumped at the chance to participate in making those vaccines available to our first responder community. So on very short notice, we were able to get those clinics set up. And the reason why we really welcomed the opportunity to participate in that effort is we've been planning for many years, as the mayor has said, to deliver vaccine. We're part of a regional emergency planning group. We have a grant. We've been, and the whole purpose of this is to allow us to dispense medications during an emergency. So for over 15 years, we've been building regional plans together. We drill those plans at least 4 times a year, if not more often. And we actually practice those drills typically during flu season, where we set up as if we're a mass dispensing clinic. The regions all support each other. We test different models, small clinics, big clinics. We've had drive-through clinics. We've set up vaccination clinics in almost every type of venue you can think of. We've been at Brooksby Farm, the International Festival, pretty much every municipal building, every public and private school building, PTO nights, the North Shore Mall, I mean, you name it, we've been vaccinating in that venue. We know we can do it, we know how to do it, we know how to scale up, and we know how to scale down. One of the benefits to all of our neighboring communities having very similar plans to us is that it really enhances our mutual aid. I know my nurse, if the Marblehead public health nurse is sick, I know my nurse can march into Marblehead and vaccinate their population because she knows their buildings and she knows their plans because it's very similar to ours, and they can support us the same way. So one of the things, One of the things that we have learned, let me go back. Yeah. So one of the things that we have learned through all this practice is that what's a great model is bringing the vaccines to where people are rather than make them come to you, right? We'd love to have a model where we had the ability to do that. Our public health nurses, in a lot of communities, the public health department will run 1 or 2 big flu clinics every year, but our model is different. Every year, our public health nurse goes to every single public housing authority building, whatever private elder housing units are willing to host her. She goes to PTO nights at every school. She goes to some of the larger businesses in the community. Analogic is one that have requested us to come in. So we've got a lot of practice here, and we think it's a great model for service delivery. But with that said, even though we're really well-versed in giving vaccines, there are some unique challenges to delivering COVID vaccine that I want to touch on briefly. First of all, it's a brand new vaccine for everybody, which means that everybody has to be monitored on site after they've been vaccinated for at least 15 minutes and up to 30 minutes, or even longer in some cases. So that means some of the models that we've used in the past, such as a drive-through model, are not really the appropriate model for COVID vaccine because it's much harder to monitor for reactions when people are in cars. You really need to have people in front of you so you can see which person's turning white and which person looks like they're going to faint. One of the biggest challenges, of course, is social distancing. Back in the days when we would do big clinics at the Council on Aging, we'd have 1,000 people in the building that we'd vaccinate over 2 hours, 2 or 3 hours. You could process them very quickly. Because of the need to keep distance, it's really changed our ability to have people in buildings for the safety of the people participating, but also the safety of our own staff. So, we're holding people inside the building. We have to keep people queued up outside, and that's not something we really want to do. One of the challenges you've heard about from the mayor is the phased-in approach for eligibility. And these groups change all the time. In the last 3 weeks, the state has changed the order of the priorities 4 times already. And they have done that in every case without advance notice to us. So we find out the same way all of you find out is by watching the news and reading the newspaper. And I fully expect we'll see additional changes. As you all know, there's advocacy groups advocating to elevate the priority for educators and funeral directors and veterinarians. So there will be a lot of changes to the priority groups, and that makes planning very challenging. One of the other unique things is this new vaccine requires 2 doses, and the timing of that dose is important. All the studies about the efficacy of the vaccine have been based on following a certain timing regimen. And so it's really important that you try to schedule the second doses within that time frame. All of those things are manageable. The biggest challenge we're facing, as the mayor alluded to, that we don't have control over, is the vaccine supply. I think most people have seen this by now, but I think it's a great graphic outlining what are the different phases. So I won't go through it all. I will point out we are currently in phase 1. Phase 2 is not yet open. Phase 2 will open next week. Sign-ups for phase 2 for the top bullet have opened. So a couple of misconceptions people have about this phasing is when people hear phase 2 is open, they think the entire phase is open, but really it's sequential. They've opened the first bullet of phase 2, and they're going to work their way down that list. The other thing I think it's important for people to look at is the schedule. Phase 1 opened in December. Phase 1 is not over. There's not even enough vaccine in the state yet to vaccinate all of the phase 1 groups. But phase 2 is starting as well. So we're going to continue to need to prioritize phase 1 people at the same time we're trying to get phase 2 people started. The other thing that's challenging about this is it was never envisioned that everybody would have access to vaccine the minute the phase opened. And of course, we appreciate the fact everybody wants to be vaccinated right away. We would love to be able to get vaccine to people immediately, but the reality is that these phases are 3 months long, each of them, and there will be people who may not be vaccinated till later in that period, or even beyond. As I said, phase 1 is probably going to go past February because there's not enough vaccine right now to vaccinate everybody in that group. So our role to date, January 11th was the first date that the state authorized us to start vaccinating first responders, and we had a clinic running that day and for the next 3 days after that. So since that first date, we've had 6 clinics. We have received from the state 430 first doses. We have distributed 440 first doses. And the reason for that is some of the vials have an extra dose in them. You don't know till you get to the end of the vial, but we don't waste any vaccine. If we can get an extra dose, we administer it. And as the mayor said, we received this week's shipment on a Tuesday, and we had it injected and done on Wednesday. So we're really trying our best to get the vaccine out as rapidly as possible. While we were at our clinic yesterday, I had to send somebody back here to City Hall because I got a text that the state has shipped us the 300 second doses for the first responders who got vaccinated a couple weeks ago. And those doses are required to be earmarked for those second doses for the first responders. So those doses will be held for those clinics, which will begin the week of February 8th, which is that proper interval for the second dose. So the populations that we vaccinated to date include Peabody Police, Peabody Fire, Atlantic Ambulance. Those are our first responders. The other phase 1 groups we've vaccinated have included some congregate care staff and residents, including folks from Northeast Arc, Citizens Inn, the Peabody Housing Authority Congregate Care Program, and healthcare workers who have an affiliation with Peabody. Either they live here and they work in a local hospital, or they live in another community, but they provide services in Peabody. So we've done the Council on Aging's Adult Day Health Program, our school nurses in the public and private schools, and the allied health professionals affiliated with Peabody Public Schools, such as occupational and physical therapists and those sort of folks, among many other healthcare professionals who work in various venues in the community. So all these pictures were taken with permission. We've got our 2 chiefs here. We've got the head of Atlantic Ambulance, chief of operations there, and one of our school nurses. We'll continue to post photos like these with permission because I think it's really important for our community to have confidence in the safety of this vaccine. And when they see community leaders they recognize, hopefully that will help build confidence among our population that it is safe to take the vaccine. Because it is. So, going forward, the state has told us that as long as the vaccine supply is limited, they are going to continue to prioritize mass vaccination sites, pharmacies, and healthcare offices in hospitals. As the mayor said, we were notified on Sunday night that our allocation will be limited to 100 doses a week throughout the month of February. So what this means is we're advising residents really to seek all opportunities for vaccination. We don't know how quickly and how much this will change, but if I have to really emphasize a message to the population tonight is that the state's plan never envisioned that most people would get their vaccine through the Board of Health. I think most people are used to thinking about the flu vaccine model. That's not what this model is. This model is you go to your pharmacy, you go to your doctor, you go to a mass vac site. That's the model that the state has set up, and we are at their mercy because they control the vaccine supply. So, their role, the way they envision our role is to be gap fillers. And as the mayor said, nobody knows our communities better than we do. And we know which populations are going to have a difficult time. Maybe there are transportation barriers, maybe there are language barriers, there are homebound folks, maybe there are people who are undocumented, who don't want to go to a large site. We will fill that role for our local community, but we will not be the primary provider of vaccine for the population of Peabody. I know there have been some questions about why we're not maintaining a list, and that is the main reason. We're not expected to be the primary provider of vaccine in our community. I went to the US Census site, and the data from the last census, which is very old now, says about 22.5% of Peabody's population is age 65 or over. That's 12,000 people. At 100 doses a week, to vaccinate 12,000 people, that's about 2.5 years. I don't want to give people a false sense of comfort that they think they're on a list that I'm going to be able to vaccinate them and them miss out on other opportunities that are much more likely to result in them actually being able to be vaccinated. So you've seen this. I won't go over this again. So going forward, our plan right now is, knowing that we're only going to have 100 doses a week, we expect to offer 1 clinic a week at the Each Region Senior Center. We have a very short window. We've been told that we should not publicize any clinics until we get confirmation that the state is going to ship vaccine to us. We placed an order last week. They didn't approve our order. We didn't get any vaccine last week. We got 100 doses this week. They told us on a Friday they approved it. They told us on a Monday they were going to ship it. And at that point, we announced, we felt comfortable, and we took a leap of faith that it would be delivered in time for our Wednesday clinic, and it was. It came in on Tuesday. We had it at our clinic on Wednesday. So we don't have a lot of lead time. I know people would love for us to announce clinic dates 2 or 3 weeks in advance so they can plan. We don't have the ability to do this. We have between 2 and 5 days to get confirmation that we're having vaccine, and only then are we going to set up appointments for people. We are using the state does have a system. I know you've all read about the problems with the system. We are using the state's prep mod system. The advantages to that system, the state has asked us to use that system because it connects directly to their inventory management system, and even though there have been some flaws in the way inventory has been managed, it's the best way that they know who's received vaccine, how much they've used, how much they still have in storage, and they will come and take it away from you if you haven't used it quickly enough. So there's an advantage that way. The other advantage of using that system is that it also connects with their statewide immunization database. So it allows us to track, who's had the vaccine, who needs a second dose. When people need a medical record for their doctors, we're able to access it through the statewide system. So there are advantages to that. The system we're using doesn't have the requirement that I've been reading about in the paper where they ask you to upload a photo of your license or your insurance cards. We don't have that component to it. So it is a little bit easier to navigate, but we do recognize that an online system is always going to present some challenges for portions of the population. And we've been working with the Council on Aging. They are going to be having people providing registration support for those who need it. They've already got some information up on their website today about how to access that. And then, of course, as the mayor has said, when our allocation of vaccine increases, we have a plan in place to ramp up to offer larger clinics and more frequent clinics.
If I could just jump in for a moment at this particular spot. First, I want to thank, as I mentioned earlier in my remarks, all of you have reached out with questions, looking for information so you could report back to the residents, all important and warranted questions. And a number of you reached out about having a meeting today, and I wanted to thank Councilor Manning-Martin, Councilor Turco, Councilor Gould, reaching out specifically to have a discussion and meeting on this. It's a great deal of information. Sharon and I have been working on it, primarily Sharon, putting this together. But we think it is important information. We were going through the slides and we thought we best to put all of them in. And then maybe moving forward when we have additional meetings, we can cut back on some of them. But in terms of the regional collaboration, I did want to touch on that for a moment because our work is really going on 2 tracks. The first is a regional collaboration, and then the second is an internal work on our end to come up with our plan to just do Peabody. We've been meeting, and primarily our health director, Sharon, and her colleagues, our nurses, have been meeting as a group, and it's been Salem, Peabody, Danvers, Beverly, Swampscott, Marblehead, Nahant, and Lynn. We've been meeting regularly, coming up with plans for the region. We did have some discussions prior to the announcement in terms of when Phase 2 was going to be starting, and we were looking at doing North Shore, Essex County regional sites. We were looking at Salem State College, which was going to be more for Salem, Nahant, Swampscott, and Marblehead. Lynn was going to do their testing, and we were looking at collaborating with Beverly and Danvers to pool our resources and our doses and try to get as many people as we can. The site we looked at, and we have a lease agreement with the North Shore Mall over in the Smoky Bones area of the North Shore Mall where there's plenty of parking. We felt being in the middle of the city that was a good location. The highway access made sense. That certainly has been put on hold because of where things stand right now. But we're ready, willing, and able to have that site available to Peabody residents. Mark Whiting and his team have been terrific, as they always are, allowing us that location. So that has been worked on. We had, I think, a tremendous plan that Sharon put together, the vaccination plan for that site. Putting that aside, as she mentioned, we are moving forward with the internal operation with our 100 doses, which will be at the Teregian Senior Center. We also have a full vaccination plan for that location, and that'll be ready to go next week. And very pleased with the work that Sharon did putting these plans together, and hoping that we get more vaccines so we can do a bigger operation. I think we have the ability to do significantly more than 100 doses, and again, we could be part of the team and really help our residents and move things along that much quicker. So I did want to speak on the regional piece, and happy to answer any questions. Sharon will just be wrapping up with a few more slides, but there had been movement along 2 tracks, and I think that'll probably continue anyway. Sharon?
Okay, so this slide is already out of date since I put it together last night, which is good news because new opportunities are coming online daily. But as the mayor mentioned, the biggest site is the mass vaccination site at Doubletree Hotel in Danvers. That is expected to ramp up to have the capability to do 5,000 people a day all week long. There are only going to be 7 of these mass vac sites in the whole state, so we're actually pretty fortunate that we are in such close proximity to one of those sites. In an effort to have more of a local presence, they're also expanding the initiative with pharmacies. So currently, as of last night, the CVS in Salem, the Walgreens in Danvers and Saugus, and the Stop and Shop in Lynn and Swampscott were already online, but I understand more have come online. And I know people won't see these links. We'll post these links to the website so people have an easy way to know where to go to register for them. The next one is through primary care providers, hospitals, and community health centers. So both Pediatric Healthcare Associates in Peabody and Pediatric Associates of Greater Salem and Beverly are taking appointments by phone. And veterans are eligible to be vaccinated at the VA hospital in Bedford. I did reach out to Leahy Clinic. Of course, the Leahy Beth Israel system serves a lot of people in our community throughout this whole region. They have sent all of their patients an email that says, we are required under the state plan to offer you vaccine. We will offer you vaccine. We will be emailing you with appointments, and please be patient. We can't give everybody an appointment right away, so please, over the coming weeks, monitor your email. So I think it's really important to recognize that all of these large medical practices will be doing something similar because they're required to do that for their patients. So the demand that we're all seeing is demand that exists because not all of these other resources are online yet. But these private practices will be offering, they will be taking care of their patients. And for many people, that will be a better option, because that's an option where they'll be able to make an appointment and go in and sit down in a waiting room while they are waiting for their appointment to be vaccinated, as opposed to coming to a big public site where they may have to stand in line and that sort of thing. So I realize everybody wants to be vaccinated right away, but some of these options I think will be very good options for people. It's really a matter of needing to be patient. And I know that's hard when you're dealing with a disease that causes so much anxiety and hardship for people. And then, of course, we're up there as a provider as well. So I wanted to show you, this is what the state's website looks like when you click on where can I get vaccinated. They've got this map with all these colored stars on it, and when you click on the stars, it will tell you what's the site, who's eligible, how do you register. We heard a lot of frustrations from people trying to navigate this system, and I know it can be complicated. One of the things I did want to mention are the yellow sites, and we're listed. That yellow site in Peabody is us. The yellow sites are restricted sites. They're either restricted because of geography, it's usually because of geography. So people should not waste their time looking for yellow sites that aren't Peabody. But all of those other sites, the red ones are mass vac sites, the blue ones are pharmacies, the green ones are medical practices. Almost all of those sites are taking patients throughout the entire state. So there's no geography restrictions on those. Okay, so just a reminder of the state's priority groups. Right now, we're in phase 1. That's the only group that's eligible to be vaccinated right now. 75 and above is coming online next week, and we're getting a lot of calls from people who want to know when are the following groups coming up, but particularly the people with comorbidities or people 65 and over. We don't know because the state has not announced those dates, and I think people make a very reasonable assumption that we have some information that the public doesn't have, but I'm here to tell you that is not true. We are finding out at the press conferences that the governor holds. So we don't have an answer to that question. I know that causes a lot of frustration and anxiety for people to not have a sense of what that time frame is. Another important point, the state tells us which populations we can order vaccine for and who we can give it to. So they're telling us, up until this week, they have told us you can only order and deliver vaccine for phase 1 groups. We do not have the ability to reclassify people into a different group. We're getting a lot of people who have really reached out to us with really compelling stories about medical conditions and caregivers to elderly parents, and it breaks our heart to have to tell them we don't have the ability to reclassify you. We really are bound to follow these statewide priority groups. The state has this self-attestation process, so when people are registering for appointments, they're supposed to meet the eligibility criteria in order to register. And there is language that says, don't register if you're not in phase 1 group. Phase 1 means you're a first responder or you're a resident of a congregate care or something like that. But there's no barrier that prevents you from registering, even if you don't meet those criteria. And that's a problem for a couple of reasons. As I experienced yesterday, our clinic, and some of you might have heard, we had some bumps because a lot of people who were not eligible to register because they were phase 2 individuals registered anyway. And when they came to our clinic and were not able to provide documentation that they were eligible for phase 1, we had to turn them away. And it was terrible. It was terrible for them. It was terrible for us. We don't have the ability. But the other thing that was really terrible about it is that those appointment slots that went to people who were not eligible prevented people who were eligible, who needed to get vaccine, were not able to register because those appointment slots were taken up by other people. So once we found out we would have extra vaccine to give, and I started calling the waiting list people, many of those people on the waiting list were healthcare providers who had not been vaccinated, who had been shut out of our clinic. and just couldn't get to our clinic in time. And that was a hardship on them as well. So we don't want that to happen. We really, really want people to respect the integrity of the system, as hard it is to wait your turn. The system depends on that happening.
And I just wanted to add to that, that Sharon had to make a difficult decision, but those people that had signed up online were not from Peabody. They were outside the city of Peabody. I would say 90%.
Most of them were.
The large majority were outside the city of Peabody. So we were able to make sure that Peabody people got the doses that we had yesterday.
So this is the self-attestation form that's on the state. You have to click off which box makes you eligible, but this is just a piece of it. There's also, this is a 3-page document, and it tells you it's not enough to click off the box. You need to show up at the site with proof that you actually are eligible. And so it's really important that people, especially, you know, if people are, as we phase in the eligibility groups, that they make sure that they read through this and they come to the site with the proper documentation, because the last thing any vaccination clinic wants to do is to have to turn somebody away who's taken the effort to get there. I wanted to speak for a minute about second doses. So the system is set up that they would like you to return to the same site you got your first dose to get your second dose. And of course, you have to get the same type of vaccine for the second dose. We've been giving Moderna vaccine. The second dose is ideally given 28 days later. So there will be periods of time when we are going back to a population we've already vaccinated to give them their second doses. We'll try to integrate first dose people into those clinics as well, but our priority is going to be to complete that series of vaccination for the people we've already started with. So it's going to look like the public that we're not vaccinating anybody, because we're not vaccinating new people. But we will be doing a really important part of the vaccination phase. But it's just one more reason why people need to recognize that there's a big system out there with lots of opportunities to get vaccinated, and, you know, don't put all your eggs in one basket. In terms of getting appointments for second doses, it will be much easier than get appointments for first doses. Either that a second dose appointment will be made at the time you get your first dose, or we as the vaccine provider will be reaching out to you to say, hey, it's time for you to come in for your second dose. We've got a clinic scheduled and you're eligible. So as I mentioned, support for people who need help accessing vaccination appointments is really important. I heard today at the governor's press conference that he's going to be setting up options that don't require electronic registration. It will allow call-in. I think that is very much needed. Peabody Council on Aging will have staff available to assist people with pre-registration. And their transportation unit is also gearing up to provide shuttle service by appointment, either to people trying to get to a local clinic that we're running at the COA, or get to their primary care office, or even get to the MassVac site in Danvers. So communications, we are going to rely, of course, on the city's website, the social media pages. Peabody Access TV will be a very important part of the communications plan. We'll update our message on the health department's phone line, and robocalls will be made to announce new clinic dates. We will use the traditional press as well, but as I've already mentioned, the timeline for us to actually advertise a clinic is pretty short, and the newspaper might not be the best venue because they may not be able to get to the press releases as quickly. In terms of outreach, the Peabody Institute Library will be hosting a forum on vaccines. We'll be participating in that. Also, Dr. Alan Chowie, who is the newly appointed city physician, will be participating, as will Dr. Laura Holland, who is the chief medical officer at Peabody Family Health Center. They'll be talking a lot about vaccine safety and efficacy, how do vaccines work, how is the process of approving this vaccine, was that managed, and we'll really be focusing more about the logistics of where you can get vaccinated and how and that sort of thing. But a really important part of our outreach is, in addition to knowing that our communities of color have been disproportionately impacted by the disease, there's also greater hesitancy among those populations to take the vaccine. We had some grant funding, our region, that Peabody is the host community for, to do a new mother home visiting project, which unfortunately, because of the pandemic, we had to table. They're allowing us to redirect that grant funding, and we've chosen to use it to put together community outreach materials to reach our Spanish-speaking and our Portuguese-speaking residents to find out what concerns they have, how can we build their confidence in the safety of the vaccine, and use media outlets and community leaders that they trust, because we really want to make sure that this vaccine is accessible to everybody. I promise I'm almost done. You'll never invite me back. I did want to mention that there's a lot of other pandemic response activities that are continuing. Contact tracing and case management continue to be very important, obviously, for our nurses. But even our inspectors are involved in that, particularly with businesses. When we're following up in cases in the businesses, the inspectors have a really important role to play in terms of reviewing the safety practices in the workplace and enhancing those pieces of it. We enforce isolation and quarantine requirements. Most people comply with these voluntarily, but some of them don't, and we have to take enforcement action to ensure the safety of our community. We work closely, many city departments are involved in this effort, providing supportive services for people who are isolating and quarantine, particularly the mayor's office. The state also has a care resource coordination team, and we partner with community agencies like Citizens In, Haven from Hunger, and North Shore Community Action Programs to get services to individuals who need support to remain in isolation and quarantine. We follow up on complaints from consumers about businesses that are not following COVID safety standards. We consult with hospitals as they're discharging patients back home, so we can make sure that they have a smooth transition with all the supports they need to come home and continue to recuperate. We do a lot of data analysis and reporting out, and of course the public information needs are huge, and it hits us from all directions, through the phone, through Facebook, emails, text messages. A lot of people, as the mayor said, have reached out to us to offer to help, and we so much appreciate that. So, some concrete steps that people in the community can take is it's very helpful for people, as I mentioned, to adhere to the priority groups and not sign up for vaccine that they're not yet eligible for. It really does protect the integrity of the entire system. If you have a friend or a neighbor that you know who might need help with registration, please try to help them or direct them to the community, to the Council on Aging. We can't let down our guard. People need to continue the good health habits we've all been practicing, the social distancing, the mask use. One of the things we're seeing a lot of is staying home if you're sick, even if your symptoms are really mild. A lot of the cases we're seeing these days are people who thought, I've just got the sniffles, I would never stay home for this. Those even very mild symptoms can be signs of COVID. We really need people to cooperate with our contact tracing efforts and with the isolation and quarantine requirements. Sometimes people don't want to cooperate because they feel like, they're, telling tales out of school, but it's really important for all of us to recognize that it's a part of our obligation to keep our friends and neighbors safe. We would ask that people go to reliable sources for information, updates, use the website resources and social media as much as possible. We really are doing our best to try to, respond to all the messages we're getting, but we are absolutely overloaded with messages, and we can't always get back to people as timely as we would like to. People would like to volunteer to help in the vaccination effort, and we love to take volunteers. They all need to be registered through the statewide mass response system. That system credentials them, they check their medical licenses if they have one, they run background checks, but most importantly, they provide liability coverage for volunteers. So we don't accept any volunteers who are not part of that system. And then lastly, we really need and hope that people will understand the need for flexibility during this emergency. The guidance changes frequently, often without advance notice to us. We're doing our best to plan ahead. We're doing our best to respond to changes in direction, and we really appreciate the patience and partnership of everybody in our community. So I want to close by thanking all of you. I've heard from, counselors very regularly throughout this pandemic, and I know our residents are lucky to have you supporting and advocating for them, and I'm always happy to try to provide you answers that you are looking for on behalf of folks who have called you, so thank you.
Thank you, Mayor Betancourt and Director Cameron. Very informative and very timely, and I appreciate your efforts on this. Are there any questions from councilors or comments at this time? Councilor Manny Martin.
Thank you, Mr. Chairman. And under suspension of the rules, move to receive 8G, a letter from Laurie Greenberg, who had sent in a lot of concerns about the vaccine phase 2, and she asked a lot of questions. So I just wanted to thank her again and other citizens who have been reaching out to us looking for information. Your input is really important, and I'm glad people take the time to send in letters asking for help and information. And thank you, Sharon, for your presentation and all the hard work that you've done over the last year. And it just seems never ending. And this, it was just the perfect storm with this technology and signing up for technology. We have, being a gateway city, 18% of our residents don't have internet access. We have, as you had mentioned earlier, or maybe the mayor mentioned earlier, that we have about 19,000 residents that are over 60. I think you said 12,000 are over 65 that just don't have the technology or the technical capabilities to have maneuvered through that, whatever that was, signing up for this vaccine. It was just a perfect storm for many people, and a lot of people were very frightened. They were frightened for themselves, their grandparents, their parents. And a lot of people in the community were just super, reaching out online on social media, reaching out to each other. Once they figured it out, they really wanted to help others, and they're still doing that now. So I commend everybody for really looking out for their neighbors. And if you know your neighbor is a senior, and don't assume that they have nieces or nephews or family members that can help them go and log in and take care of this. Just check on your neighbors and see if you can help out, if you're able to do it yourself, to continue to do those things. And I commend everybody for just really jumping in, rolling up their sleeves, and trying to help each other out. And we'll all get through this. It's a very difficult time, and it's very stressful for a very vulnerable population, but we will get through this if we continue to look out for each other and help each other. And along those lines, Mayor, you sent out a robocall with a lot of information, the one that was very recent, kind of a thumbnail of tonight's information, but it was a lot of information for a robocall. And I was wondering, does your robocall service have the capability to identify people by their age and send out just a specific robocall that tells them that if you're 70, if you capture the group that's 65 and older or 75, and give them the Council on Aging phone number if they need help to sign up? Are you able to do those things with the robocall device? And the reason I say that is I'm just really concerned that we are, even no matter how hard we try, with today's information, all relying on technology that everybody doesn't have, I'm just really concerned that we just inevitably leave people behind, no matter how hard we try. So, and if you could see when you had your slides up, Sharon, you put up a whole bunch of very important links for information. But many people don't have the internet or they don't have the computers. So all of the information that we're disseminating is at no fault of our own. It's just the way of the world now, is out through links and the internet, and you have to have computer access. So those without those things will be left behind, and they won't know that the information is out there. So are you able to do that, Mayor, to call them on their phones, their landline, and really just make sure that they have the information? Then maybe then they can call in to the Council on Aging that Council on Aging can follow up with them to make sure that they get the assistance that they need. Are you able to do that?
Thank you, Councilor. And I just want to first say, I think your words were right on. It has been wonderful to see so many people helping out one another. I do not believe we have that capability to break it down by age, but I think your suggestions are good, and I think maybe if we can take that back and see if there's ways we can structure our message to certain groups, particularly the seniors. So I don't think we have that capability under our Code Red system to break it down by age, but maybe there's some way through some lists that maybe the senior center has, or the library, or some other that we have in the city. Maybe we can put together something to try to reach specifically those most vulnerable. So yeah, let us work on that a little bit.
Thank you very much. And then just one other concern I had along those lines is whenever there's a catastrophe like this, it opens the gate for elder fraud and financial exploitation. So for folks at home, make sure you know who's calling you. That's why I kind of want the message, Mayor, to come from you, to have them call the Council on Aging, tell them what number to call, instead of random people calling them, and they may fall for some elder financial exploitation. So that's another concern. I'm sure that the Peabody police are preparing for that, and other police departments are preparing for that as well. So for those of you at home, make sure you're very careful on, as always, when you give out your information on the phone when anyone calls. Just don't do it. Okay, thank you. Thank you very much again, Sharon.
Thank you, Councilman Martin. You mentioned in your comments item 8G. Did you want to make a motion to accept?
Yes, motion to accept item 8G. So moved. Thank you, Mr. Chairman.
You've heard the motion by Councilman Martin. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rossignol,
Yes.
Melville.
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor Gould?
Thank you, Mr. President. Mayor, thank you so much for this presentation, but none of it would be would take place if it wasn't for Sharon Cameron. Sharon, you're unbelievable. If there's any community that is capable of pulling together a vaccination program, it's right here in Peabody. Sharon, without getting into the weeds, just a quick, 2 quick questions. I get asked all the time by food workers how they fit in what phase they're in. Is that the bottom of phase 2, not just grocery, but retail food?
It's my understanding that they would fall into the middle of phase 2 with the essential workers. There's a whole pretty broad category of people in food service, public works employees. It's the same bullet as the educators currently are in.
Okay. And also, Sharon, utility workers, that's another question that I get asked.
I don't know specifically, but I think they're probably in that same group. One of the challenges is that the CDC has a set of priorities that categorizes essential workers, but the Massachusetts priority list doesn't really start talking about essential workers until that bullet that includes all the educators. They've really prioritized people based on age and health conditions, and they don't really have the essential worker category until later.
Okay, thank you. Sharon, thank you so much for everything you do for us.
Thank you, Councilor Gould. Councilor Turco?
Thank you, Mr. President. I wanted to start by saying, Mayor, thank you so much for your words at the very beginning of this, which seems like maybe it was an hour and a half ago. No offense, Sharon. But, Mayor, as you were speaking, I don't want to say I was angry. I was kind of upset that you're 100% spot on. This should be taken care of at the local level, or more so at the local level, and eliminate two pieces of government on the state and the federal level that we know, with 3 layers of government involved here, it's only going to slow the process, where we could very easily be vaccinating many more of our residents. And I don't mean just through Sharon Cameron and the health department. I mean through the countless volunteers that have reached out to me personally, and nurses and doctors that live in this city who would be more than happy to give their time to get this done. So the reason I started with that is I'd like to know, first of all, I would love to sign on whatever letter you write, and if it's being written to the state delegation, or the governor's office, or both, I would like to sign on to that request in that letter to do so. And if you need that in the form of a motion on behalf of this council, I would love to do that. But you are 100% on, so I'll take this shot now and ask for support from the council in the form of a motion to sign on to the mayor's letter and ask that the local health department in the city of Peabody and other cities and towns have more input into the vaccination program. So moved.
Thank you, Councilor Turco. You've heard the motion by Councilor Turco. Is there any discussion? Councilor McGinn.
Thank you, Mr. President. On the motion, I endorse that 100%, Councilor Turco. I just wanted to get some feedback from the mayor to find out if that's specifically what he was looking for. You asked the council for some support, and was that the form of support that you need to be most effective?
Yes, I was hoping that the motion would be made and we would have your support. I would like to send that to certainly the governor, lieutenant governor, Secretary Sutters, and our state legislators, asking them for their support, which I'm sure it will be there. But I just think we need to be vocal, express our concerns, talk about what we have that we can, how we can assist them, and that's all. I just want to be part of a team, and I think a motion supported by the council would really be a terrific gesture and supportive.
Thank you, Mr. Mayor. Thank you, Mr. President.
Thank you, Councilor McGinn. Is there any other further discussion? Councilor Sasslaw on the motion.
Thank you. I will obviously support that motion. I just did want to ask the mayor, have you had any dialogue with State Rep Walsh, Kearns, or Senator Lovely at this point? I was just curious.
Yes, very much so. In fact, yesterday we did, and COVID is the #1 topic, certainly. So yes, we've had a number of discussions.
And are they, do they feel basically the same way you do when they're pushing the Baker administration to maybe push it down to the local Board of Health?
I don't want to say, I don't want to put, I think they would be supportive, but I can't definitively say that. I certainly think that they're like all of us, want to get this out the best way they can and in the quickest way possible, but I don't know specifically what actions or what they would support, but I'd like to hold off on that for now, I guess.
Thank you. No further questions.
Thank you, Councilor Sasslaw. Any further discussion on this motion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manny Martin.
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Matsoulis,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor Turco?
Thank you, Mr. President, and I'll be brief. I know we're very far behind. So I wanted to say that I wholeheartedly agree with Councilor Manning in the sense that the last thing we want to see is some of these elderly residents being lost in the shuffle. And, any way we can reach out to the mayor, whether it be even if you need door knockers, I mean, I'm sure we'd have plenty of people knock on doors. If you needed, letters, whatever you need to do, but sometimes the robocalls aren't the most effective. I just like to see us try to make sure that those that are 75 and older or get contacted and have this information. And lastly, through you, Mr. President, to Director Cameron, Sharon, you had said you administered 440 doses. So you have a running total of who you've vaccinated, but do we know what the total is for all of Peabody's residents that may have been vaccinated elsewhere, at their workplaces, or what that total is?
We do not, and actually the mayors and the health directors in this region have a meeting tomorrow morning with Secretary Sutters, and that is one of the agenda items, is we would like that data because it's very important.
Thank you. Yeah, and then one of the positive things, it's sad to say, but every day when I look at social media, I see somebody else holding up their vaccination card, and I'm truly happy for that person, and I'm truly happy for this city that each and every day more people are vaccinated, and it's hope that I'll be at the beach in July. Definitely not wearing a bathing suit of any sort. Maybe a sweatshirt. I've gained the COVID weight, so I'll leave it at that.
Thank you, Councilor Gould. Councilor Turco. Councilor Mello, please.
Thank you, Mr. President. Mr. Mayor, Sharon, as always, very thorough. I know right now what's happening is you have competing agendas with different groups who, are actively trying to support, their work, what they do for their profession. And it's understandable. I think everybody's trying to do the right thing at the federal, the state level. And then obviously where the rubber hits the road is the local level. And we know this as people that work in local government. Just a couple of questions. Sharon, if you were to, first off, if you look at the application, there is a section that asks about your health insurance. So just to dovetail on that, obviously I think they're trying to go through providers so they can collect, they're going to charge the health insurance companies. So your health insurance could be charged if you go. If they were to go through the Board of Health, is that similar that the health insurance, what I'm just saying is there's going to be people without health insurance that are going to see this application that's going to ask for health insurance, and we want to make sure that they know they got a place to go.
We do attempt to collect health insurance information because it helps support, we obviously need to hire infrastructure, additional vaccinators, all that. So the health insurance reimbursement will help support that, but nobody would be turned away because of lack of insurance.
Thank you. I think that's a very important part of the health insurance reimbursement portion that doesn't get talked about because that's very technical. In that, from a Board of Health, if you were to have to ramp up, and I think you guys are going to actually be more involved than I think the state is anticipating because of the size of the uninsured, and I'm not so sure the private entities are going to be looking for their people outside of their either their healthcare providing system to go to go vaccinate people that aren't within, they're going to be emailing their people directly, as you said. So I do think that there's going to be a major role for the boards of health. How much lead-up time will you need to staff up to be prepared for something? Say, you were going to have 1,500 residents that you would anticipate vaccinating.
We anticipate to ramp up to that through contracts. We've already started conversations with Atlantic Ambulance Service. They have already begun hiring additional vaccinators, so I think we would have the ability to contract with them to ramp up fairly quickly because they're already anticipating providing that service for many communities.
Great. I know you're way ahead of the game. And I think you're doing a great job. And I just, your staff too, I can imagine, they're having very difficult conversations with folks. So from me, and I'm sure I'm speaking for our residents and the council, continue doing it. You guys are literally on the front lines. It's very easy for people that aren't involved in it every day to thank you, but I know it's having to turn somebody away from having a vaccine is very difficult. And I think, frankly, we should take a minute to, what a miracle that we're actually talking about a vaccine less than a year after this craziness started. So thank you for everything you're doing. I'm sure we'll have some more questions as it comes up, but you've been very available. Appreciate your help, and thank you.
Thank you, Councilor Melville. Councilor Rossignol.
Thank you, Mr. President. Through you to Sharon Cameron. Thank you very much for all of this information. Outstanding job as always. As Councilor Turco mentioned, you have already vaccinated 440 individuals, and that's outstanding. And I know that you had also mentioned the difficulty in getting more and more vaccines. With that said, do you already have earmarks for the original 440 individuals that you've already vaccinated?
We've received 300 doses earmarked for second doses, so we expect that we'll be receiving the additional second doses for that other group, but they didn't all get vaccinated at the same time, so they're not due yet, so it's not a capacity concern for us right now.
But you don't anticipate that being an issue?
We do not anticipate that being an issue. We do anticipate that there may be a little bit of lag. We might not be able to meet that optimal 28-day period, but we do expect within a reasonable period of time that we'll be able to procure second doses for everybody.
Thank you very much.
Thank you, Councilor Rossignol. Councilor Trest.
Thank you, Council President. Again, Sharon, fantastic work, like everyone says. The one thing is, you bring it straight to us. As many times as I've watched the information from the State House through almost every day, they've never been as clear as you've been and as transparent and just matter of fact. I mean, there's no BS, and I think that's what people are really looking to filter through. So keep that going. That's always been your way anyway, so I do appreciate it because it makes it more thorough and understanding, okay? On this, is there, maybe this doesn't, with this branch of government, but do people have protection when they get an appointment to get a shot from their work? Do you know if that's, I'm hearing people saying to me, what happens if I have to leave work to get the shot? Is there protection for them? Do you know if that, any of that, or where that could be, where they can find that out?
Councilor, yeah, that's a good question. I do not, we do not know the answer to that. That's a good question. We can ask our legal counsel, but that's a very good question. I just don't have an answer for you at this time.
Yeah, that'd be good if we could. The other thing, Mr. Mayor, I know we talked about, again, getting everyone informed, and again, by some people having these scams come by. I think there's been a lot of information out there about that, but can we get any information in the light bill? Because we do know that is a resource that almost everybody gets in this city.
Yes, I think that's a good suggestion. I think we can work on that.
Okay, thank you. And when I'm hearing this, and one of the things that comes in my mind, and probably most people, it's a scary thought. I think of the Titanic, about how many people, who can get in the lifeboat, right? And oh no, you can't get in, but you can, and the pushing and the shoving, and I can see that, unfortunately. And you mentioned that we have 100 doses for Peabody. Without half this picking and being crude about it, should we keep those vaccines for Peabody residents, even with people you have mentioned have working facilities here in Peabody, but that's not Peabody residents? I know that's it's hard for me to ask that, but is that something that we really should focus on, since you are talking about these other locations that people are going to go? I would have to say that would be my opinion.
No, I agree with you. For phase one, where it was really based on occupational categories of first responders and healthcare workers, it made sense to us to allow people who worked in Peabody to participate in that. But for phase two groups, we will not be opening it up. For 100 doses, we will be reserving those for Peabody residents, and that's part of why I had people angry at me yesterday, because I was adamant that those 100 doses we need to keep in our community.
Yeah, and again, I'm glad you pointed out that, I'm not saying I resent the police, fire, first responders in that first phase, no matter where they lived, they were working here in Peabody. And I have all the respect for those folks. Numerous times they had to come to my house for one reason or another, so I don't want to phase those out. But going forward, again, thank you very much. And again, Sharon, you're going to deserve a great vacation after all this. And there's nobody that I've seen in this state and all the time I've watched it that I would rather have here than you. And Mayor, I'll deliver that letter if you don't want to send it electronically. Because we need to do it here in Peabody, and like you said, we have the capability, and I'm damn proud of that. Thank you.
Thank you, Councilor Charest. Councilor McGinn.
Thank you, Mr. President, and I add my words of thanks to you, Mr. Mayor, and especially you, Director Cameron, for all your incredible work through this crisis. My question is kind of an add-on to Councilor Rosignol's question about the second doses. Will the mass vaccination sites in these other locations, like the pharmacies and so forth, have the same requirement that the municipality will for setting aside a second dose for that same population? I mean, should people have an expectation that if they go to the DoubleTree, they're going to end up going back to the DoubleTree? And is that automated some way? Do people get a call or an email, or somehow do they get notified that they have another follow-up appointment for their second dose, or do they have to get in the queue again and potentially miss that 28-day window? So could you just add a little bit about the mechanics of the second dose?
Yeah, so my understanding of the mass vac sites, and I don't know anybody who's actually gone to one yet, but how it's supposed to work in all parts of the system is you're supposed to get your second dose where you got your first dose. So my understanding is at the time they give you your first dose at the mass vac site, they're going to give you an appointment for your second dose. The way we've been handling it at our clinics, because we don't know when our doses are coming back to us, they have a much more reliable vaccine stream than we do because they're the ones being prioritized. We will electronically reach out to people through that system we use to notify them, you're coming due for your 28 days, we've got a clinic on such and such a date, we're holding an appointment for you. So the second dose appointments will be much easier to get than the first dose appointments.
Great, that's good to hear. Thank you, Mr. President.
Thank you, Councilor McGinn. Are there any other councilors who want to comment or ask any questions at this time? Thank you, Mayor Betancourt and Director Cameron, for coming tonight and giving a great presentation, and also for all your work on this effort. Thank you again.
Thank you, Council.
At this time, we're going to move on to the next items on the agenda, which are item 4, hearings. We'll start with hearing 4A, Class 2 motor vehicle license transfer for Mr. Kamil Babayev, 288 Newbury Street. The clerk will please read the notice, please.
Notice is hereby given that the City Council of the City of Peabody will conduct a public hearing on Thursday evening, January 28, 2021 at 7:30 p.m. and conduct said public hearing in person, City Council only, in the Frank L. Wigan Auditorium, 24 Lowell Street, Peabody, Mass., and remotely via Zoom for all other public participation on the application from Kamil Babayev, care of Broadway Auto Motors, Inc., 435 Broadway, Malden, Mass., requesting the transfer of a Class 2 motor vehicle license from Elchin Nadarov, DBA Improtex Auto, Inc., at 288 Newbury Street, Peabody, Mass. For remote participation using the Zoom platform, please visit www.peabody-ms.gov city.city-ma.gov under City Calendar on the homepage, or contact the City Clerk's office. Zoom information will not be available until the Friday before the meeting. Peabody City Council, Councilor Mark J. O'Neill, City Council President.
Thank you. Welcome, Mr. Babiev. Could you please state your full name and address for the record, as well as anything you'd like to have us hear about your request?
Good evening, sir. My full name is Camille Babiev.
Excuse me, Mr. Babiev. We're having a difficulty hearing you. Can you please speak closer to your microphone? Thank you.
Good evening, sir. My name is Camille Babiev. My address is 435 Broadway Street in Malden, Mass. 02 148.
Thank you. Is there anything you'd like to add regarding your transfer request at this time?
About this visit, and I'm trying to transfer the license to my from Elchin Nadirov's name under my name.
Thank you, Mr. Babiev. Are there any members of the general public who would like to speak either in favor or in opposition of this application? Please raise your hand in the Zoom application if you'd like to speak in this matter. Are there any members of the general public who would like to speak either in favor or in opposition of this application? Please raise your hand in the Zoom application if you would like to speak on this matter. Seeing no one, Councilor Sasslaw.
Thank you, Council President. I'd like to make a motion on the suspension of rules to receive item 8C.
Thank you, Councilor Sasslaw. You've heard the motion. Sorry, Councilor Sasslaw. Clerk wanted to make sure that the motion was to receive and approve. 8C, please.
I'm sorry, you cut out on me. I'm sorry, did you say something about 8C?
One moment, Councilor Sasslaw. I just have a question.
Sure.
Sorry for the delay, Councilor Sasslaw. As this is, we're moving this item 8C, communication is to transfer the special permit into the other name, so we are looking for a motion to receive and approve. Is that sufficient?
Yes, sir, correct.
You've heard the motion. Any discussion? Hearing none. Roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Thank you. Councilor Sasslaw?
Thank you. I had the opportunity to meet with both the current owner and the proposed new owner. I'm comfortable with the transfer and will be supporting it tonight. The only item I did want to bring to their attention is they do understand it's 2 hearings. We'll open it tonight, continue it, and then vote on it at the next meeting most likely. That being said, I did want to ask the petitioner, are they aware that there are some delinquent taxes that are due on the property? Noted $2,039.52 was due on the 12th of January. And then there's another tax bill due of about approximately $80 due on February 1st. Those taxes must be paid before we can approve the transfer at the next meeting. So I just want to bring that to the applicant's attention. Other than that, they have done a good job as far as this lot was this is on Route 1 South. It's the first piece of property. It's on the Danvers Peabody line. I'm sure many of you are familiar with it. And the owner just repaved the entire lot, which was a major upgrade. And the current owner has worked hard at trying to improve the property, and we've worked together on that. And once again, I'll be supporting this transfer, and I'll open up my fellow councils.
Thank you, Councilor Sasslaw. Are there any comments or questions from other councils? Councilor McGinn.
Thank you, Mr. President. Through you to Councilor Sasslaw. Councilor Sasslaw, this, you mentioned it in your comments, and I think I remember this one from previously. Half of this, or a portion, significant portion of this operation is in Danvers. Do we happen to know if Danvers has already taken a similar action on this?
If I could, through you to the president, through you, President, I am not aware if they have done anything with Danvers at this point.
Hey, maybe the question is better directed to the applicant.
Mr. Babayev?
Hi, good evening. I am Elchin. My name is Elchin, the current owner. I just want to talk about the Denver's portion. Before I sold this the place to the Kamil Babayev, I've been in the Denver City Hall, and they gave me paperwork about the Denver's part that I can put the cars, like display cars. I have some paperwork from the Denver City Hall for the Denver's part after the line.
Thank you, Mr. President.
Are there any other questions or comments from other councilors? Councilor Charles?
To the chair, just to be clear, we're not voting on this tonight. We're just going to recess it until next meeting because of the taxes, correct?
Councilor Charles, point of order, we're going to recess all hearings tonight until February 11th. Other questions or comments? Seeing none, Councilor Sasslaw?
So just through you to the petitioner, just so they're clear, Mr. Bayev and Mr. Nadarov, are you aware of the outstanding tax bill, and do you understand that that must be paid in full before the next meeting, and you'll have to get clerk Forth will provide that once those taxes are paid to the council. You do understand that?
We know about these taxes. We will pay that tax before 11 February.
Thank you. No further questions for me this evening, Councilor President. Motion to continue the public hearing until February 11th, 2021.
Thank you, Councilor Sasslaw. You've heard the motion to recess this hearing until Thursday, February 11th. Any discussion? Hearing none. Roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rossignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Next item on the agenda is hearing 4B, special permit for Marlon Ramirez, 145 Summer Street, to operate a film and photography studio. Clerk, will you please read the notice?
Notice is hereby given that the City Council of the City of Peabody, acting as the special permit granting authority, will conduct a public hearing on Thursday evening, January 28, 2021, at 7:30 p.m. and conduct said public hearing in person, City Council only, in the Frank L. Wigan Auditorium, 24 Lowell Street, Peabody, Mass., and remotely via Zoom for all other public participation on the application from Marlon Ramirez, 22 Hancock Street, Peabody, Mass., for a special permit seeking to operate a film and photography studio at 145 Summit Street, Unit 3, Peabody, Mass., is filed in accordance with Sections 4.2.5, 6.1, and 15.7 of the Peabody zoning ordinance. For remote participation using the Zoom platform, please visit www.peabody-ma.gov under City Calendar on the homepage or contact the City Clerk's office. Zoom information will not be available until the Friday before the meeting. Peabody City Council, Councilor Mark J. O'Neill, City Council President.
Thank you. Welcome, Mr. Ramirez. Could you please state your full name and address for the record, as well as anything you'd like us to hear about your request?
Sure. My name is Marlon Ramirez. I live at 22 Hancock Street, Peabody, Mass. And I've been doing this for about 10 years. I do it all from weddings, music videos, events, commercials. I've done promo videos for Tasso Nicolakopoulos, and he was running for councilor at large in the city of Lynn. I also did all the promotional videos for Brian Castellanos, and he was running for the Lynn School Committee, and he's in office as we speak.
Thank you. Are there any members of the general public who'd like to speak either in favor or in opposition to this application? Please raise your hand in the Zoom application if you'd like to speak on this matter. Are there any members of the general public who'd like to speak either in favor or in opposition of this application? Please raise your hand in the Zoom application if you'd like to speak on this matter. Seeing no one, Councilor Turco.
Thank you, Mr. President. So as we all know, Councilor Welton couldn't be here tonight due to the birth of Samuel John Welton. So again, congratulations to him. I did meet with Marlon a little over a week ago at the site. As you know, there are 4 locations there. It's at the corner of Linfield Street and Summit. In that, I'll call it a strip mall, Plum Tomatoes, Hackett Brothers Plumbing, Vincent Bianco Catering, and Marlon will fill the 4th spot with his photography studio. There's 19 parking spaces, which he's included in the packet, which I think is sufficient for these 4 uses at the building, since they're pretty low impact. And, you know, specifically Marlon himself, his photography studio is by appointment only. I think a lot of the time it'll be him in there doing some work with a videography or photography. When he does have appointments, it may be 1 or 2 clients at most. Since the last approval at this site was Bianco and Sons, and we've had no issues with the parking. As you know, in the past there were some issues next door. I think one time there was an issue that came up because there was a tasting at the site, but it's been rectified, and as you can tell by the lack of appearance from the neighbor, I think everybody's happy there. I think Marlon would be an asset to the community. As he said, he's done some work for some elected officials in Lynn. He comes highly recommended by those people. I did reach out to some residents of Lynn and people that have used him. He's very well spoken of, and again, as a Peabody resident, I wish him the best of luck, and I will support this permit wholeheartedly.
Thank you, Councilor Turco. Are there any other comments or questions from other councilors? Councilor Sasslaw? Sorry, just a hand motion. Seeing none, Councilor Turco.
Thank you, Mr. President. I'd move to recess the hearing of Marlon Ramirez, 145 Summit Street, Unit 3, to operate a film and photography studio till February 11th. So moved.
Thank you, Councilor Turco. You've heard the motion. Any discussion on the motion? Seeing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Thank you, Mr. Ramirez. We'll now move to hearing 4C, entertainment license for Martino Grill, limited liability company doing business as Eatery 58 Market Street Place. Allow for live and non-live entertainment. Clerk, please read the notice.
Notice is hereby given that the City Council of the City of Peabody will conduct a public hearing on Thursday evening, January 28, 2021, at 7:30 p.m. and conduct said public hearing in person, City Council only, in the Frank L. Wigan Auditorium, 24 Lowell Street, Peabody, Mass., and remotely via Zoom for all other public participation on the application from Martino Grill, LLC, DBA Eatery 58 Marketplace, 58 Pulaski Street, Peabody, Mass., requesting an entertainment license for both live and non-live entertainment at said 58 Pulaski Street, Peabody, Mass. Non-live entertainment will consist of televisions and digital internet jukebox, and live entertainment will consist of live music, karaoke, and DJ in the lounge area only. For remote participation using the Zoom platform, please visit www.peabody-ma.gov under City Calendar on the homepage or contact the City Clerk's office. Zoom information will not be available until the Friday before the meeting. Peabody City Council, Councilor Mark J. O'Neill, City Council President.
Thank you. I can see that the petitioner is on the Zoom application. Welcome. Could you please state your full name and address for the record, as well as anything you'd like us to hear about your request?
My name is Frank Martino. The address is 58 Pulaski Street, Peabody, Mass. The grill, Martino Grill, 58. And I am here. I'm ready to answer any questions.
Thank you, Mr. Martino. Are there any members of the general public who would either like to speak in favor or in opposition of this application? Please raise your hand in the Zoom application if you'd like to speak on this matter. Are there any members of the general public who would like to speak either in favor or in opposition of this application? Please raise your hand in the Zoom application if you'd like to speak on this matter. Seeing no one, Councilor Matsoulis.
Thank you, Mr. Chairman. Mr. Chairman, I went and met Mr. Martino this past Tuesday. As you know, I always like to go to the locations that are before us for a special permit. And I want to tell you, I was very impressed with what I saw. A beautiful, huge restaurant and lounge, and it was very impressive. And Mr. Martino and myself walked around the property, and he pointed out where he wanted the TVs, which was very acceptable. He also mentioned that he wanted outside, on the outside lounge, the deck outside, that he wanted to put a TV out there. I personally do not have a problem with that. If any of you councilors do have a problem with that, let me know. We will exclude the TV outside. And he mentioned the live music that he wanted, and he wanted one singer and 3 musicians, which is fine with me. But as I said, I will put a restriction on if he has a night with the singer and the 3 musicians. They usually draw a big crowd, and I'm concerned about the safety. If he would have some type of detail there. I mean, I know the Peabody Police do not do details, but if he could put a doorman at the door or some security, I don't know. I'm going to leave that up to him. That's his responsibility. And one of the things that I always tell anybody coming in for an entertainment license, they are responsible. And if anything happens, we're very strict on this council. You know, we don't take fights and anything like that lightly. But I'm not expecting that, but I do tell that to any applicant. I think Mr. Martino is going to do well there, and we're all rooting for that location to do well. So I myself am planning on supporting the applicant, and I will leave any questions to the rest of the council. Thank you, Mr. Chairman.
Thank you, Councilor Matsoulis. Are there any comments or questions from other councilors? Councilor Gould.
Thank you, Mr. President. Through you, Mr. President, to Councilor Matsoulis. Jim,
yeah.
Can you tell me, 58 Pulaski Street is that series of buildings on the right, and I know the eatery. Where is the deck that he's looking to put
That's right in front of the eatery. That's where no, the deck is already there.
Right, so, but the TV is going to be on the deck?
Right.
How about the live entertainment? That's staying inside, right?
All the entertainment is inside, yes.
Okay.
Yep.
Thank you, Mr. President. Thank you, Jim.
Yep.
Thank you, Council Gould. Any other comments? Councilor Manny Martin.
Thank you, Mr. Chairman. Through you to Council Mitsoulas. It wasn't clear. I really couldn't hear you, Council Mitsoulas, when you mentioned a detail. Are you requiring a police detail with this entertainment license?
Well, listen, I probably should have been a little more clearer on this. When I had mentioned about live entertainment, and I say this no matter where the place is, wherever the lounge is, if they're having live entertainment, it's usually pretty lively and they draw a big crowd. And that building is pretty large. He will draw a big crowd there. And he, on his own, volunteered that he would get some type of detail, you know, a doorman or whatever he has to hire to, you know, make sure that no arguments or fights break up. Am I clear? Is that?
Yes, so you're not requiring a detail. It would just be at his discretion to maintain a safe establishment, whatever, because it's not required at other establishments. So that's clear to me now, Demo. Thank you.
Right. Thank you, Ann. He volunteered that, Ann. I should have mentioned that. He volunteered that before I even mentioned it to him. I think he has experience in the business. He knows what he's doing. So.
Thank you, Councilman Martin. Any other councilors have a question or comments on this? Council Mitsoulas, I'll entertain a motion to recess this hearing until February 11th.
Thank you, Mr. Chairman. I'd like to make a motion to continue this meeting till the 11th of February, 2021. So moved.
Thank you, Councilman Mitsoulas. You've heard the motion. Is there any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Thank you, Mr. Martino.
Thank you very much, gentlemen.
Next item on the agenda is 4D, show cause hearing. Councilor Charest.
Thank you, Council President. Under the suspension of rules, I'd like to move to accept late communication 3. So move. And just, I did notice on 3, I believe there's a typo on under the agreement lettering E, where it says 9 Andover. I believe that's just a typo. There's supposed to be 8. That's it. Just want to make sure a typo.
Thank you, Councilor Charest. The clerk is mentioning that 8 and 9, it's known as both, if you will.
Okay. Just want to make sure. I know we, through the president, I know we refer, they refer through this agreement 8 and 2 Endicott and other places. So I just want to make sure it's connected the same.
Thank you, Councilor Charest. You've heard the motion by Councilor Charest. Any comments or questions from fellow councilors? Sorry. Yep. Motion is to, you've heard the Councilor Charest's motion to receive late communication 3. Roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Thank you, Council President. I'd like to make, make a motion
Councilor
to...
Charest.
Thank you, Council President. Motion to move to authorize City Solicitor Don Kahn to sign the agreement on behalf of the City Council. So move.
Thank you, Councilor Charest. You've heard the motion from Councilor Charest. Any discussion? Councilor McGinn.
Thank you, Mr. President. Yeah, on the motion, is it, and through you to Attorney Khan, is it safe to say that this has been thoroughly reviewed by you, Attorney Khan?
Yes, it has, Councilor McGinn. The agreement, as you know, resulted from some zoning violations that were uncovered by our Inspectional Service Department and citations that issued. This agreement includes acceptance of responsibility by the property owners, and it includes steps to make sure that violations do not occur in the future. And there's also a provision in the agreement that indicates that in the event that the limits of the license were not complied with in the future, that would be a violation of this agreement. And it has been, I have reviewed it in detail.
Thank you, Attorney Khan. Thank you, Mr. President.
Thank you, Councilor McGinn. Any other comments on the motion? Councilor Melville.
Thank you very much, Mr. President. Through you to Attorney Khan. So do we have to renew, because if I remember, this came up during a renewal discussion with regards to this particular special permit. Is this something that we then, are you going to, once they meet these guidelines, we'll then renew the special permit based on this agreement?
Well, the agreement provides that the Class 2 license is to be renewed, provided that they comply with the safeguards that are set forth in the agreement. And if a month from now we found them to be in violation again, they would be in violation of this agreement. And you would still have jurisdiction to take whatever actions what you would deem appropriate, up to and including suspension or revocation of the license.
All right. Through the President to Attorney Khan. So I guess what I'm saying is, when do we renew? Are we renewing this tonight after accepting this agreement, or a month from now is what the proposal is?
If you approve this agreement, you would be renewing the license now.
Okay.
And they would be under an obligation to continue undertaking the steps to comply with the agreement.
Very good. Thank you.
Thank you, Councilor Melville. Any other? Councilor Turco.
Thank you, Mr. President. Regarding the motion, I just wanted to be sure, since I see Commissioner Tallarico and Randy Suckney from Inspectional Services, that they're content with this, because the work that they've put into this is actually, it's disheartening to see the work they had to put in to straighten this out, and I thank them both for it, particularly the work that Randy put in and sent to us. I couldn't believe the amount of visits that he took place. So I realize legal is happy with it, but I want to make sure Inspectional Commissioner Tallarico is content with this agreement. Through you, Mr. President, to Mr. Tallarico.
Mr. Tallarico?
I want to start by thanking the City Council for helping resolve the issue. Without this meeting, I'm sure that we wouldn't have a positive outcome, or it would have taken just a lot longer. As you can see, Randy's notes, it's been very challenging, to say the least, to clean up these two properties. All you are probably aware of that, that they signed the agreement, and we don't have a problem moving the license forward. We do hope that the property owner understands that he must be consistently maintain this agreement indefinitely. He has a responsibility, not just to his businesses and his homes that he owns on that property, but to his neighbors and their quality of life. So I hope that you can see that this has been, and I've had numerous discussions with with a lot of you regarding this property, and it's been a long time coming. It was just a cat and mouse play for quite a long time, and I'm hoping that now that the tenant next door is vacating the property, that a lot of the issues are gone, and we can, and I also want to thank the Peabody Police Department for going out there with Randy, and they were very supportive in helping us try to resolve the issue. Thank you.
Thank you, Commissioner. Thank you, Mr. President. That's all.
Thank you, Councilor Turco. Any other, on the motion, Councilor Manning Martin?
Thank you, and thank you for all the work. Thank you, Mr. Chairman. Through you to Al Tellerico and Randy Suckney, and specifically to Randy, you were treated really, really poorly and shabbily, I might say. And I found in your notes, copious notes, that went on for 1.5 years of the work that you put into this, that it was rather abusive behavior. And I just wanted to thank you for, sticking to your guns, sticking to your job, doing what you're supposed to do. And just for residents at home and businesses at home, people come out to your property or your business, they're doing a job, they're following policies and procedures of the city. The city council sends them there, and we're really just holding people accountable, and that's all he's doing, and he shouldn't be treated that way. And city workers should not be treated that way when they're out conducting the people's business, holding people accountable, and doing the right thing, so that we can have a city that is run fairly and safely. And the way you were treated was terrible, and I just thank you for sticking it out, seeing it through, and that this is coming to a resolution. So I thank you very much.
Thank you, Councilor Manning Martin. Councilor Gould on the motion.
Thank you, Mr. President. Thank you, Inspector Suckney, for the job well done. You took on a tough task and saw it to the end. Commissioner Tellerico, thank you very much. And Captain Richard, you and your team. I personally know the former owners of the property who still have the sales license, and they are both very humbled and willing to do the right thing. It's Mr. Kiley and Mr. Kavanaugh. So I think it's something that is going to work out well for everybody. Thank you for your time.
Thank you, Councilor Gould. Councilor Rossignol on the motion.
Thank you. I'll be brief. I just wanted to thank Randy Suckney as well as Commissioner Tellerico for all of their hard work in getting this done. And please come back before us if you notice that any item of this agreement is breached, so that we're not in this situation again. So thank you very much.
Thank you, Councilor Rossignol. Councilor Charest.
Thank you. And just on the motion, I want to tell you that I had been working with this with Councilor Masulis for the last several weeks. And it is only the reason why we're at this settlement now is because of the prep work that Al Tellerico, Randy Suckney did, and the police department, Captain Richards, and his officers, of the detailed information that they kept and continuing to follow up on complaints. This is the only reason why we're at this point of being able to hold people accountable and have a settlement like this. I call it a settlement. I strongly believe now that it's the way it's written, we totally understand how that operation there, who's doing what, where, and everything else is very clear. So again, I applaud because they have done such a great job, and only because of the work they've done is the reason why we're able to make sure that property is cleaned up. So just with that, I settle on my motion and like to move.
Thank you, Councilor Charest. Any further discussion on the motion? Hearing none. You've heard the motion by Councilor Charest to move to authorize City Councilor Don Kahn to sign the agreement on behalf of the City Council Roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Thank you, Councilor Charest.
Thank you, Council President. I'd like to move to rescind the order of show cause hearing for Wilson Square Auto Sales. So move.
You've heard the motion by Councilor Charest. Any discussion on the motion? Seeing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill. Motion carries 10-0.
Councilor Charest.
Thank you. I'd like to move to renew of tonight the Class 2 motor vehicle license issued to Wilson Square Auto Sales, 2 Andover Street, Peabody, Mass., subject to conditions AE of the agreement between Joanne LLC, Wilson Square Auto Sales, John Kelty, attorney for Wilson Square Auto Sales, in the city of Peabody. So move.
Point of order, Councilor Charest. I just wanted to make sure I heard correctly. Was your motion, did it include conditions A through G in the agreement? Councilor Charest, I'm sorry, I couldn't hear you.
I'm sorry, yes.
Thank you. You've heard the motion.
With all the conditions, yes.
You've heard the motion by Councilor Charest. Any discussion on the motion? Hearing none. You've heard the motion. Roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Thank you. And I just want to thank you all for your efforts on this situation and also being very patient tonight on a Thursday evening to wait for this hearing. Thank you.
Thanks.
We'll now move to item 5 on the agenda, reports of committees. The Finance Committee, Councilor McGinn.
Thank you, Mr. President. Finance Committee of the PBC City Council met earlier this evening, January 28th. Present for the committee were Councilors Gould, Manning Martin, Rozignol, Turco, and myself as chair. Also present were Councilors Mitsoulas, Charis, Sasslaw, O'Neill, and Melville. There were 2 items on the agenda. The first item was a transfer of fund request for facilities, salaries full-time. We had a brief presentation by the Director of Finance, Mr. Gingras, and His Honor the Mayor. Answered several questions from the committee. Ultimately resulted in a motion by Councilor Gould as follows. Move to approve the transfer request from budgetary reserve account number 100-01320-57410 in the amount of $200,000 to facilities salaries full-time account number 100-49055110 in an amount of $200,000. That motion passed in committee by a vote of 4-1. And I now bring that same motion to the full council for consideration. Mr. President, so moved.
Thank you, Councilor McGinn. You've heard the motion by Councilor McGinn. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
No.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 9-1.
Councilor McGinn.
Thank you, Mr. President. The second item on the agenda was a transfer of fund request for library books and subscriptions in an amount of $65,000 and salaries full-time in an amount of $74,000. Again, we had a presentation on this matter from His Honor the Mayor, as well as Library Director Merlin, was present to answer questions. Also present was the chair of the, the president of the Peabody Library Trustees, Mr. Thomas Pappas. There was a number of questions about this. Ultimately, the transfer request was to enable the library to maintain its services and, as importantly, its accreditation status. In the end, there was a motion by Councilor Gould as follows: move to approve the transfer from budget reserve account number 1000132055741, an amount of $139,000 to library books and subscriptions, account number 1006010573660, an amount of $65,000, and salaries full-time in amount, account number 1006010511110 in an amount of $74,000. That motion passed unanimously, and I now bring that for consideration to the full council. So moved, Mr. President.
Thank you, Councilor McGinn. You've heard the motion by Councilor McGinn. Is there any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rossignol,
Yes.
Melville, O'Neill.
Yes.
Motion carries 10-0.
Thank you, Councilor McGinn. We'll now move to item 6 on the agenda, motions, orders, and resolutions. Councilor Gould.
Thank you, Mr. President. I'd like to make a motion to have the Department of Public Services, specifically the Water Department, fix the height of a water valve at 35 Evans Road. It's a trip hazard. It's on the sidewalk, and it's 2 to 3 inches above the height of the sidewalk. Someone's going to really get hurt. So moved.
Thank you, Councilor Gould. You've heard the motion by Councilor Gould. Is there any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rossignol,
Yes.
Melville.
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor Gould.
Thank you, Mr. President. In the form of a motion, I'd like to set up a meeting of the Industrial Community Development Committee, Subcommittee, to review the revised Peabody Housing Production Plan that is back with us, and invite the mayor and the Community Development Director, Bellavance. So moved. And I'm sorry, I'd like that to be on February 11th, if we could, Allison, please.
Thank you, Councilor Gould. You've heard the motion. Is there any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rossignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor Gould.
No further motions, Mr. President. Thank you.
Thank you, Councilor Gould. Councilor Manning Martin.
Thank you, Mr. Chairman. I would like to request of Mr. Gingras a information that we had spoken about earlier, but I wanted to make it in the form of a motion to request a total of the transfer of funds that have occurred this fiscal year, and to provide one every time there's an update. Anytime we transfer funds, that he give us an updated amount. So moved.
Thank you, Councilman Manning Martin. You've heard the motion. Is there any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charist,
Yes.
McGinn,
No.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
No.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 8-2.
Councilor Manning Martin.
Thank you, Mr. Chairman, that's all.
Thank you, Councilor Manning Martin. Councilor Sasslaw.
Thank you, Council President. I have no motions, orders, or resolutions, but I do want to share one issue that was a little bit disheartening, and I'm going to be entering this into the record. I received an email from a resident in Ward 5, and basically I'm sharing this because I'd like to discuss it further, and I'm sure many of you can identify. And the neighbor had emailed me last Friday, and we had a conversation, and they were concerned that a neighbor was blowing leaves and debris out onto the street. And this is a new person, new homeowner. They're proud to live in Peabody, but they are very appalled at what's going on. And I said to the neighbor, I said, you know, I appreciate you reaching out to me. I said, take a drive by, because I believe I know who the offender is, because I have a repeat offender who does this. And so I drove by, and it's on the corner, and come to find out, it wasn't the offender I thought. It was basically someone right around the corner. And what I'm concerned about is that one neighbor seeing someone blow leaves and debris out into the street, another neighbor seeing it. And when this happened a few years ago with this habitual offender, we have nothing on the books. We have no ordinance. You know, it was during the summertime, and we have college kids who come back and they intern with the Department of Public Services, and they went out and they cleaned it up. But, you know, to me, that wasn't a resolution. I wasn't happy about it. And so now I have a second scenario situation. So I'm going to forward this email to the council to read. I did go look at the ordinance, and I looked at a little bit about, the only thing I could find that was like it was snow removal. And I know we have something on the books about, you know, downtown, they have to do the sidewalks a certain amount of time, and it's a little bit different based upon where you live in the city. And it says the police shall be the enforcing agency. I don't believe there's any fine or any, you know, I don't know what that really means. And if anyone, you know, is aware of any fines or anything that we do have, you know, there's nothing with the stick, I guess. So, you know, I'm sure it's happened, and we try and just kind of look the other way, or maybe call up DPS and say, hey, can you pick it up? But I feel that, you know, I'm probably not the only one, and I want to look at this, and I'm looking for some help, and I'm looking for some ideas. And as I said, I will forward this to be in the record for the next meeting. And then at some point, as I said, I would like to have a discussion about it, because I think it's important, and it talks about, you know, it's about, we got to keep for the people who don't, it's just not fair that the neighbors who live across the street or have to put up with it, or, you know, they see that, you know, DPS is picking up the guys who leaves. I think I've said enough. I think you all get it, but I am looking for some ideas, and I'm open to anything at all. And it was that important enough that I did want to bring it up. And as I said, I will take this email, put it into the record, and I look forward to discussing it further.
Thank you, Councilor Sasslaw. We look forward to seeing that email so we can have further discussion. I see Councilor Gould raising his hand.
Thank you, Mr. President. Councilor Sasslaw, I couldn't agree with you more. It's something that goes on in every neighborhood, and we have to do something about it. I would think that there's got to be an ordinance through the police department about littering the roadways, unsafety. I mean, I'd almost like to see it put in a subcommittee, but this is your motion. But then we can invite people to come and weigh in on it, such as Captain Richards. So, thank you, Mr. President.
Thank you, Councilor Gould. Councilor Sasslaw.
Thank you, Council President, and thank you, Council Gould, for your support. did realize we probably need to put it in a subcommittee. I mean, it probably is public safety because it is an issue, and I leave that up. So that's probably where it's going to end up. And like I said, I remember, I think when I spoke to Building Inspector Talrico, our commissioner, I think he was a little bit, kind of frustrated too. And so I'll go through the ordinance. I'll reach out to, I'll look and see if there's any about littering. That's a great suggestion. And we'll continue this discussion.
Because that's what it is, Counselor. It really is littering the roadways.
Absolutely.
Thank you.
Thank you. Nothing further, Council President. Thank you very much.
Thank you, Councilor Sasslaw.
Council President, on that?
Councilor Shrest.
Point of information. For Councilor Sasslaw, there is an ordinance. And I had mentioned this numerous times, especially right when I first got on, because my pet peeve is when people blow the leaves and the sand, and especially when it's professional landscapers who are blowing all the debris out in the street, and especially in the spring when you're driving down the street and next thing you know, your windows are down and you're getting blasted with a bunch of sand being blown into your face. There is an ordinance on it, and it's tucked away a little bit, but it's about throwing debris and litter in the roadway. Al Talarico does know a little bit about it because I work with him on it. It's the enforcement. That's the stickler, is the enforcement on it, and I believe it is not a code enforcer, or the police department may be the ones who enforce these codes. You have to check with that, but I love to talk more, and there's other communities do not tolerate it at all, and I think we should be one of those communities that don't tolerate the pushing of the leaves and the sand and debris into the roadways, because it always gets caught up in the catch basin, and they're probably the first person who calls up your ward councilor and says, my catch basin is full and covered, who's going to open it up for me? So I'm frustrated as much as you, so I'd love to see we act on something to correct it, especially before the springtime. Thank you.
Thank you, Councilor Shrest, for that information. Councilor Shrest, motions, orders, and resolutions.
Thank you. I have no motions. I just want to congratulate Emily and Craig Welton on their birth of their child. And I do believe he put out a challenge to the mayor. Now he has 5 and the mayor has 4. So I think this is a little bit of a challenge out there for the mayor if he wants to take him up on it. But it's a beautiful baby. And I don't remember the last time one of the sitting councilors, had a child while they were sitting in as a councilor. So I would love to, if we can send a congratulating card to the Weltons on their birth from the council. So move.
Thank you, Councilor Shrest. You've heard the motion by Councilor Shrest. Any discussion? Roll call vote.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville, O'Neill.
Yes.
Motion carries 10-0.
Thank you, Councilor Shrest. Councilor McGinn.
Thank you, Mr. President. Under suspension of the rules, move to receive item 8D and approve the transfer of special permit number 21 dated October 3rd, 1983, and special permit number 19 dated July 19th, 2016, to EDE Food Enterprises, LLC, 135 Washington Street, Peabody, Mass., subject to the existing conditions and all papers being ordered. So moved.
Thank you, Councilor McGinn. You've heard the motion by Councilor McGinn. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor McGinn.
Thank you, Mr. President. Under suspension of the rules, move to receive and approve item 8E.
Thank you, Councilor McGinn. You've heard the motion from Councilor McGinn. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol.
Present.
Did you say present? Melville.
Yes.
O'Neill.
Yes.
Motion carries 9-0.
Councilor McGinn.
Thank you, Mr. President. Suspension of the rules, move to approve entertainment license 2021 renewal, Italian American Citizens Club, 7 Blaney Avenue, all papers being in order, so moved.
Thank you, Councilor McGinn. You've heard the motion by Councilor McGinn. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor McGinn.
Thank you, Mr. President. On suspension of the rules, move to approve item 9C, general license 2021 renewal, lodging house license, Skelkos Brothers Realty Trust, 14 Foster Street, all papers being in order, so moved.
Thank you, Councilor McGinn. You've heard the motion by Councilor McGinn. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
McGinn.
Thank you, Mr. President. No further motions.
Thank you, Councilor McGinn. Councilor Mitsoulas.
Thank you, Mr. Chairman. I'd like to make a motion to have Public Works install a one-way sign on Tremont Street on the bottom end, Mr. Chairman. So moved.
Thank you, Councilor Mitsoulas. On a point of order, should we have the police review that request just to make sure that it's in compliance with our,
No, Mr. Chairman, the sign is not there. It's missing.
Thank you, Councilor Mitsoulas. I didn't hear you say it was a replacement. You've heard the motion by Councilor Mitsoulas. Any discussion? Seeing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw, Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor Mitsoulas.
That's it, Mr. Chairman. Thank you.
Thank you, Councilor Mitsoulas. Councilor Turco.
Thank you, Mr. President. Move to, under suspension of the rules, move to receive and approve all papers being in order. Late add 2.
Thank you, Councilor Turco. You've heard the motion from Councilor Turco. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor Turco.
Thank you, Mr. President. Move to, under suspension of the rules, move to receive and refer to the upcoming, I believe it's public safety meeting for the Linfield Street, Bartholomew Street intersection, item 8F.
Thank you, Councilor Turco. I believe it's the Municipal Safety Committee, but if that's okay, we'll amend the motion, but get that to the right committee. You've heard the motion by Councilor Turco. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charist,
Yes.
McGinn, Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilor Turco.
Thank you, Mr. President. And one final motion, It's a motion to have DPS repair the street signs at the end of Veterans Memorial Drive. They're both bent over. One is the street designation sign, and the other is a stop sign. Both posts are bent. If they could repair both those items. So moved.
Thank you, Councilor Turco. You've heard the motion by Councilor Turco. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville.
Yes.
O'Neill. Motion carries 10-0.
Thank you, Councilor Turco. Councilor Rozignol.
Thank you, Mr. President. Under suspension of the rules, I'd like to receive and approve all papers being in order. Class 2 motor vehicle license, 2021 renewal for Boyd Cycle, 25 Walnut Street. D&D Auto Sales, 39 Walnut Street. North Shore Auto Sales, 218B Newbury Street. 222 Newbury Motors, 222 Newbury Street. So moved.
Thank you, Councilor Rozignol. You've heard the motion by Councilor Rozignol. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
No further motions at this time. I just want to say congratulations to the Walton family. Thank you.
Thank you, Councilor Rozignol. Councilor Melville.
Thank you, Mr. President. I have two motions. The first one is dealing with a question to community development and the city solicitor's office. A couple weeks back, the governor signed a new law that impacts zoning regulations, among other things. My motion would be to request from the city solicitor and the community development office a brief and summary on how that new law impacts cities with regards to their zoning, what procedural changes will occur, and what changes in the amount of votes required to make such changes. So moved.
Thank you, Councilor Melville. You've heard the motion by Councilor Melville. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville, O'Neill.
Yes.
Motion carries 10-0.
Councilor Melville.
Thank you, Mr. President. The second motion is to request feedback from the city clerk, the Board of Registrars, and any members of the public with regards to the voting locations used in the 2020 election and their impact on future, being used as future locations for the 2021 election and going forward. Through the clerk, you can forward those to the Legal Affairs Subcommittee meeting for a future meeting that we can discuss the feedback that we receive based on the public and the appropriate boards that represent that. So moved.
Thank you, Councilor Melville. You've heard the motion by Councilor Melville. Is there any discussion on the motion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin, Sasslaw,
Yes.
Charis,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
No further motions this evening, unless, do we have anything?
Excuse me, President.
I'm all set. Thank you very much, Mr. President.
Thank you, Councilor Melville.
Excuse me, Council President.
Councilor Sasslaw?
Thank you. I don't think we have a take a vote. I'd like to make a motion to bring the issue of debris and litter to the committee of the Municipal Safety Committee. So move that issue.
Thank you, Councilor Sasslaw. Just to restate the motion, this was to have the issue that you brought up regarding debris, leaves, or anything being put into the street. and you wanted to make sure that the municipal safety, the public safety committee reviews that matter, subcommittee. Did I accurately capture that, Councilor Sasslaw?
I wanted to go to a municipal safety committee. Correct.
Thank you, Councilor Sasslaw. You've heard the motion by Councilor Sasslaw. Is there any discussion on it? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville, O'Neill.
Yes.
Motion carries 10-0.
Mr. President. Mr. President.
Councilor Gould?
Thank you. I'm sorry. Allison, could you please amend my motion to make it a co-motion with Councilor Mitsoulas to have the water valve lowered or fixed, please? Thank you.
Mr. Chairman.
Councilor Mitsoulas.
Thank you, Tom. I appreciate that.
I'm sorry I forgot you, Jim.
You're the best, Tom. Thanks.
Yeah, thanks, Jim.
Thank you, Councilor Gould and Councilor Mitsoulas. Can I get a motion to accept communication 8A, please? Excuse me, can I get a motion to receive and approve?
So moved.
Thank you, Councilor Melville. You've heard the motion from Councilor Melville. Any discussion? Hearing none, roll call vote, please.
Councilors Gould,
Yes.
Manning Martin,
Yes.
Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 10-0.
Councilors, for point of good order, we need to make sure that we receive item late communication 1 that was received in finance. We need to receive it. And
So moved, Mr. President.
So moved, Mr. Chairman.
apologize, my hearing is going tonight. We need to receive communication, late communication 1, and also communication 8B, please.
Mr. Chairman, that should have been in my report of committee. I apologize for that oversight. So moved.
Thank you. You've heard the motion by Councilman McGinn. Any discussion? Roll call vote, please.
Councilors Gould,
Yes.
Manning Martin.
Yes.
Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas,
Yes.
Turco, Rozignol,
Yes.
Melville, O'Neill.
Yes.
Motion carries 10-0.
I have no motions or orders or resolutions. I'll entertain a motion to adjourn.
Counselor,
Motion to adjourn.
so if I may.
Councilor Charest on the motion.
Not on the motion, but on, I've overlooked one recognition I'd like to make is, announces the PAT had received an award tonight on their, the information they had on COVID. I think Jim Palmer maybe here can, if he wanted to say what it was exactly about. I just got a quick word that they got a award on it, on COVID, and since we were speaking about COVID tonight, I just want to make sure it's recognized. So moved.
Thank you, Councilor Charest. I think maybe we can set some time up where they can kind of talk about that because we want to make sure we give it proper time to recognize them. On the motion to adjourn, any further discussion? You've heard the motion. Roll call vote, please.
Councilors Gould,
Yes.
Manning Martin.
Yes.
Sasslaw,
Yes.
Charist,
Yes.
McGinn,
Yes.
Mitsoulas, Turco,
Yes.
Rozignol,
Yes.
Melville,
Yes.
O'Neill.
Yes.
Motion carries 9-0.
This meeting is adjourned.
Thank you.
Thank you.